Welcome back to the Radiant Podcast, your go-to source for digital product-focused discussions on design, technology, and digital health advancements. I'm Maxwell Murray, your host, and I hope today's episode inspires your next big idea. In this episode,
we're dealing with patient post-surgery. So they're in pain, they're uncomfortable. You cannot just create a technology that's going to make them answer questions and enter data. So we have to listen to the user first. What's the condition they're using the platform under?
Hi, Talal. I want to thank you for joining us on the podcast here. Everyone, we have Talal Ali Ahmad, founder and CEO of Predictive Healthcare, joining us today on the Radiant Podcast, and we're going to talk to you about post-surgery care and an amazing application that he and his team is building called MyHealthPal.
Hi, Max. Thanks for having me and giving me the time for this lovely broadcast.
So, there's quite a bit of buzz at all times surrounding artificial intelligence, AI, and all of that. And you have a digital product that leverages AI. And I just wanted you kind of to tell us about Predictive Healthcare. What was the inspiration behind this application? What does it do?
Well, thanks for the time again. And you started on the right point by saying we use AI to leverage post-surgery digital health, because AI is a technology which we use to help us make the product MyHealthPal. So let me take you back to the company. Predictive Healthcare, it's a Massachusetts-based startup company. We started 2 years ago. What we're building and we built so far is a platform. We monitor post-operative surgical incision to predict early sign of infection and alert the clinician to intervene at early stage before becoming chronic issue, to cut down readmission and unnecessary office visit or emergency room visit. So the product is called MyHealthPal. It's an AI-based algorithm that's monitor surgical incision using the patient's smartphone device, and also we collect vital signs data to come up with the prediction for the clinician.
So I want to unpack that. It's not only the visual detection of the surgical wound as it healed, it's paired with data entry, implying like this adherence to the care plan from the patient and clinicians watching out. And then is there some type of like numbers driven quantitative, hey, these vital signs are moving in this direction, we're predicting X, Y, Z?
So, so for one disclaimer, I'm not a doctor. So all the information I'm giving is based on my discussion with the surgeon and clinician about that. The product has a two-part. One is visual, like you said. The patient will take a picture of the surgical incision based on a schedule set by the clinician. Could be every day, every other day. We analyze the image first, and we look for any sign of elevated risk of infection. Could be redness, could be discharge, whatever, based on the wound. And the second part is we collect data from the patient on the vital signs and other key points. For example, body temperature, pain level, if they have any nausea, or the wound is warm to the touch, plus medication adherence. We take all this data to help to assist the clinician to make a decision at the end of the day, because if you look at the image, you may see a sign of something boiling on the image, something you need to be addressed right away. And sometimes the image looks like everything's normal, but the data, like the patient reporting for high fever, high pain level, the wound is warm to the touch, that means something's happening. So we provide that data to the clinician in order to make their decision. And what we're working on right now is trying to take both images and data to correlate the data together and come up with one predictive outcome for the clinician.
Wow. So it's visual detection and data that drives, better care for the patient. And when I love you saying over and over, while you're not a physician, you're listening deeply to this audience. And that's one thing that I want to underscore. I default to think about patients very carefully. Recently, I've made more visits to healthcare providers than normal. I guess that comes with adding years to one's life. But I'm starting to also recognize how overwhelming that perspective can be and trying to increase empathy for people in that space. So it's good to hear you say
Yeah,
we're talking to clinicians, we're trying to figure out how we can make this complicated process less complicated.
exactly. I mean, in any technology you provide, so the technology has to work for the user, not the other way around. So
Mm,
we have to listen to the user first. Who's the user? What's the condition they're using the platform under? So we're dealing with patient post-surgery. So they're in pain, they're uncomfortable. You cannot sit down and just create a technology that's going to make them sit for half an hour, answer questions, and enter data. It has to be based on the situation. You're in pain, you're uncomfortable. You're gonna give us a minute to answer a few questions. And the same thing for the clinician. They're busy, they're between surgery or between patient. They're not gonna sit and go through screen after screen to look at what we're sending them. And that's the key: is talk to the user, understand the user situation and the condition, then create an application based on that.
this dovetails into something nicely that I want to touch on, because one thing that I'm often curious about is interoperability,
Yeah.
that bridge between these amazing digital product solutions like yours that are
Mhm.
on the horizon and moving things in the right direction. But if it's done in the absence of actually connecting to the current system, those
Yeah.
core systems like EMRs, EHRs, you know, again,
Yeah.
clinicians need that data in the right place. How do you
Sure.
streamline and make that connection? Can you talk to us about integration with current systems and MyHealthPal?
So, based on my previous experience in medtech, so I understand you cannot have multiple systems for the user to use. And we're talking here on the clinician. You cannot ask the clinician, enter data here and see the result here. Or when you want to see what's going on, you have to look at this screen all the time. So we made a decision from day one to be HIPAA compliant and address all the HIPAA compliant standard in our platform. The second thing is when we have that is integrate with the EMR system. That's the must because we want to have a seamless flow between our data, both directions, and the EMR. So we integrated with the Epic. We are on Epic Marketplace right now. MyHealthPal is on Epic Marketplace. We tested, so we're ready for that. MyHealthPal is a three modules: one mobile app for the user, one for the patient, one mobile app for the clinician, and a dashboard for the clinician. So the clinician has two options to look at the data. When we select the clinician select the patient to use the app, we create the user on the app, and we have a profile of the patient. So and then we use that data when patients submitted their pictures, their vital signs. We send an alert to the clinician on their phone or the dashboard, and we can push the result directly to Epic. So we don't want for the made decision from day one. We don't want the clinician to go log in on MyHealthPal, enter data, and then when they receive a result or elevator or alert, go back to Epic and enter what they saw in there. So we have a seamless connection between the two. We pull data from Epic to create the account, and then we push back the data to Epic, and we push it in two ways. One is field by field, or we can create what will look like a lab report. They can upload it to Epic and they can look at it at all time. So we make it so flexible, so we're not tied up to one system only. And this is based on feedback from the doctor, what they want to see when they get the alert. They want to see the image, they want to see any data, and then they want to print it or send it to Epic. It's up to them. And everything is going smoothly between Epic and our platform. I mean, we started with Epic because Epic is right now is kind of everybody's talk about it, and most hospitals use Epic. But if we are looking at integrating other EMR and EHR system also.
All right, you beat me to my question. So there's a
Yeah, yeah, no, the roadmap is full. Other EMR, EHR system because the product is meant to our target customer hospitals, surgical centers, wound care facility, and skilled nurse facility. And there's a different EMR, EHR used by different, depends on this kind of the hospital surgical center. So we have to be available for different platform.
last time you and I chatted in person, you're sharing some exciting news and some new spaces where there's more activity surrounding using the application, and there's some clinical studies
Yeah.
that are active right now. Can you tell us about those and talk to us about
Yeah.
how you got them in position in the first place and where they're at now?
Yeah, so the first one, when we did the first pilot with the Global Smile Foundation, they're a Boston-based NGO. They travel outside the US to do cleft lip and cleft palate surgeries. So they were our first pilot outside the US, and they use it for almost a year. And now we convert them to a customer as part of their standard of care right now when they travel outside the US. So that's kind of the giving back. They were nice and flexible as to do the pilot, so we gave back and say, hey, if you see value in it, must well use it on your mission. So they're actively
Incredible.
using. They have a 300 plus patients on the platform. In the meantime, because of the US based, the Global Smile has a US based surgeon travel with them. So that's when the buzz was created. Like we start meeting surgeon, we're doing this, hey, can take a look at it closer for my clinic. And that's when we met our different clinician and surgeon from Tufts Medical Center, which he heard about the application. He's involved with the Global Smile at some level. And we agreed like, hey, maybe we can give it a try in our clinic, and they agree because today, post-surgery, the clinician flying blind. They have no visibility on the patient recovery or the wound recovery and with little help. The only thing they know, if the patient calls on time, say, hey, I think there's something wrong, can I come in? But most of the time is because patients in pain, uncomfortable, they call they call the last minute, and the doctor most of the time say you need to come in or you need to go to emergency room. So they need something to connect to the patient during the recovery period, and that's where the value. Tufts Medical Center and their Dr. Humsi who's the primary surgeon is going to use that with us on for pilots. Actually, it's starting this month, so we're recruiting patient as we speak for the pilot. And on the other way, Mass General, we're doing the second pilot of Mass General. Mass General, kind of we approached them. We approached the innovation center at Mass General, and they were kind enough to see the value what we're presenting, and they put us in touch with the surgeon in the cardiology department. Say they make the introduction, they look at it and say, hey, there's a value here we can use to connect to the patient, and we'll be doing pilot with Mass General for the a pacemaker implant surgery patient. So then when patient goes home, they want to monitor the patient during that period. And it varies because at Tufts Medical Center, they be doing breast reconstruction for cancer patient. That's what we'll be using the app with. Where Mass General use it for pacemaker implant surgery. And they're two different surgery, but they both have the um, same requirement. We need to monitor the patient during that process after surgery. We need to be connected. We need to know early enough what's going on with the patient before it becomes an issue and we see him in the emergency room.
This has profound implications. Thank you for sharing about the trials and your progress
Yeah.
thus far, from the more philanthropic to the here at home angle, all very interesting. But now I'm going to make it about me.
Okay.
I just, when you said, the experience for the patient kind of becomes this thing where they let things get a little rough, more painful, and more of a state of emergency, and they end up in the emergency room. It's been years since I've been to an emergency room, but I recently had to go to one. Thankfully, nothing, catastrophic issue resolved, but the bills are coming in and I'm looking at the numbers and I'm like, wait a minute, like, imagine for people that imagine what it's like for people that experience these things frequently because they have a much more severe condition than anything that I'm dealing with. And this is a regular occurrence. That was kind of like a moment where I had to step back and recognize when we talk about all of these things, there are people really going through a lot on both sides of the table. The patient, of course, and the clinician that's trying to juggle all of these things. And the patient who this is their fourth visit to a facility in a very short span of time, and they're taking time off work and they're worried about their bill. This is not just cool. Oh, we built an AI solution and, oh, punch numbers in. It's fun to play with application. This is something that's supposed to better our quality of life, improve our experience as patients and clinicians.
Yeah,
Uh, so I just want to
absolutely.
underscore that.
Yeah, post-op surgery recovery is very critical. I mean, it costs, let's put it in perspective, it costs the US healthcare system by itself from unnecessary emergency room and visit $3.3 billion a year. That's from the visit. We're not, and that's most of the time the hospital has to eat that cost
Wow.
because after surgery, the global payment cover your visit to the emergency room the first 30 days or 60 days, depends on that. So when I go to the emergency room, and I discharge after that, the cost of me coming to the emergency room, forget my insurance, copay, and all this stuff. The hospital has to eat that cost because it's part of the global payment. So the hospital at the hook on that. It's not like they're going to recover from the payer. At the same time, for patient, I mean, none of us lives 5 minutes walking away from the emergency room. We all live like 20 minutes, 30 minutes, that, and with no traffic, give it the Boston area.
Yeah.
It's going to take an hour to get there. You get there, they're busy. By the time you see the doctors, like, and they do the test, it's gone 6 hours. And most of the time, it's like, okay, we see what's going on. There's no need to be here. You can go back home and take this medication or do this and follow these steps. So it both sides. For the hospitals, there's the resources. When you come into emergency room when you don't need to, there's a financial loss. And for the patient, it's the quality of care coming. You might catch something coming to emergency room too. There's a risk of coming to emergency room and catch a virus or you get infected with the wound. So we're trying to improve the financial side from the hospitals, eliminate them and cut down on resources needs for that visit, and at the same time improve the healthcare outcome for the patient. And this is by connecting, using AI to leverage that what we build to connect the patient to the doctor, address it. I mean, it doesn't mean our MyHealthPal is going to prevent all the visits to emergency room.
Right.
The doctor might say, "Okay, something going on. I need to see you." But if they catch it early, they can address the issue early before it becomes a major problem. And that's what the value proposition for MyHealthPal. Detect early sign of infection early, alert the clinician, address it early before becoming chronic issue. And that's the value for us. Is if my health catching stuff when inflamed, then there's so many issues, then we're not doing our job. We need to catch it way early to intervene way early before it become a major issue for the clinician and for the hospital and then for the patient.
Yeah, that's awesome. Yeah, it's like this AI powered telemetry tool that is outfitted to improve patient experience and reduce costs. That's what
Exactly.
I just heard. The other thing I want to bring up is I know we both live in the Boston area. That emergency room description, minus the catching a virus thing, that was literally my experience. I'm gonna be looking over my shoulder to see if you're observing me as a patient case study. Uh,
I hope nobody goes to emergency room, but at least once in a lifetime. And I have kids. I've been to the emergency room so many times, and I don't want to be there. I don't. I
yeah,
mean, it's not a place you want to spend your day there.
yeah, yeah. You want to be there when you need it, but to your point, with all the inefficiencies and the substandard things that take place sometimes when we try to receive care, these are the type of tools we need to be building to reduce and the problems and improve wherever we can. I continue to dive into user oriented stuff because we help our audience understand how to build products like the one that you're building, and how do you approach these daunting tasks and user stories that may arise. Can you talk to us about your early stage user experience design, how your team explored that, what methods you use to gather information in order to build your application the right way, and as you look forward, how will you continue to enrich user experience for those platform?
We so the experience, like our approach was a little bit different because we're dealing with post-op patient. It's not like you can ask someone, do you remember when you had a surgery, how did you feel? So we didn't have this luxury. So
Oh,
we started with the clinician first, say what information you need and how do you like it to be presented to you.
okay.
So that's what we started. We talked a lot of surgeons and nurse practitioner and clinician about like what they want to see, how did the data, and how much time they want to spend on the screen. And we start from that. And then we ask him what kind of data the patient do you think he can send, and they say, well, picture would be great because picture can say 1,000 words, and then the vital signs. So we build the application, and the user's feedback, the patient's feedback, we get it from during the pilot phase, not before the development. We assume a lot of stuff because we deal with a surgical patient. Unless you ask a surgical post-op patient, and usually not going to get the answer because in pain and uncomfortable, they're not going to sit down and answer a question about building an application. So during the pilot, when we deploy the first pilot with Global Smile, that's when we get a lot of feedback, and we ask a lot of questions from the patient. Hey, how do you like the data entry? Is it the right format for you? It's easy to enter it. It's easy to understand. The same thing, the picture. I can give you, for example, when we first did the pilot, we asked patients to take a picture of the wound. We get so many selfies, like someone like proposing on social media. We went back, okay, and we can detect the wound very well. So we had to, okay, well, we can't detect anything. The application's not working. We found out, we look at the images, they're selfies. Somebody's trying to take a picture. I'm like,
Get your
wait a
ankle
second,
right.
we can't do this. So we went back and say, okay, we need to add something to the software, and that's where we come up with the image acquisition algorithm, where we ask the patient to point the camera, the phone at the wound, and we auto detect the wound, and we ask them to adjust their camera. It's similar what you have today with the mobile deposit for your check. You put your
Right.
check, say closer. We did exact same thing, but for us is we focusing on the wound itself or the angle, and we auto adjust the lighting too. So we make sure the image always clear. And then that's the feedback we get in real time from the patient, and went back and to the drawing board and said, we need to implement this. And the same thing with the data entry, numbers or scrolling bar or sliders. A
Yeah.
lot of people like that. Slider is easy for me. I can put it and just slide it and move on instead of trying to scroll up and down numbers. So
Yeah.
the patient side was the hardest one because we had to wait until the users start using the app.
Yeah.
Then we get a lot of feedback. On the surgeon side, they've seen a lot of app. They've been using their phone, different app. So they were like, hey, I can show you this app. They're not your competitors, they're not, but like see how they did the interface. So they were sharing with us ideas, which was
Yeah.
great. I mean, for me is I love UI and UX people, but sometimes if an application being used and everybody love it, might as well don't introduce something new to the user if they
Mhm.
all used to this model. So that's what we start looking. The doctor used to use it this way. Let's keep them the same way. Unless we found a major flaws in it, we're trying to convince them. But we end up using the same kind of process they use today, implemented so they don't have to relearn new things. And for the patient, we end up learning in the field.
When we're building digital products in the healthcare space, we have to remember that, as you said, physicians are experiencing world-class apps in various verticals and
Yeah,
industry and parts of their life, from watching videos with their family to storing their family photos to uploading their personal docs and managing their personal docs. And
yeah,
patients are ordering something from Amazon and it arrives the next day and it's
yeah,
convenient. There's a photograph of the
yeah,
package placed where they said they wanted it to be placed, and they could
yeah,
cancel the order and change their order. Or, you land at an airport in California and you're on a trip and you
yeah,
can count on Uber and Lyft to give you an experience that will take you where you want to go, and hold
yeah,
the people that are working with you and transporting you accountable, and all these
mhm,
like layers. You said something profound. We have to look beyond just our space and listen to our users when they tell us, hey, I'm used to an experience like
yeah,
this. Hey, a pattern of a user journey like ABCD makes a lot of sense to me because I've seen it elsewhere. Or
yeah,
professionally, I know that uh, Epic orders these fields at my organization in this way. Can the app do that? Because other apps are out of order and the integration doesn't
yeah,
seem to work, or it just breaks my workflow.
yeah.
Um, that's very important.
The key for us is you need to make the technology works for the user, not the other way around.
Yeah.
If the user is going to spend time to learn and do things and trying to make the application work, we're not providing any value, anything. We need the application, the technology to work for the user not the other way around. So, and you're in the medical technology field, you understand. Doctors, they always work by 3 or 4 clicks. If they don't get anything after the third click, they move on to the next one. I'm not, hopefully I'm not offending anybody, but that's the nature of the work. They need to on the go. They will look at things and click, click, move on.
Mhm.
For engineer like me, if it doesn't work, I can spend extra 10 minutes discovering why it's not working and make it work.
Yeah,
But for doctor, no, if it doesn't work, move on, next one.
yeah.
So that's a key.
On that note, how are you achieving that 3 to 4 click experience with physicians? I know you started with them as that core user to help you nail down the initial application. What's the ongoing engagement with physicians and clinicians? How's that work? What's your game plan to stay on top of their user needs going forward?
So we still, I mean, we never stop communicating with the clinician and the surgeon because it's their workload is changing and the data they want to look at it is different. Also, they have a system or a flow they have to follow in the hospital. So for them is like when we started, we send an alert to the phone. They will open, they get the alert on the phone, they look at it, and then move on. What we did by talking to them is we put the elevated risk alert first. So we'll come up on the screen first always. And what the algorithm detect normal standard risk will be in the bottom. So the doctor is like, when they get alert open up, they see the first, maybe the first three, which are high level or elevated risk. They click on them, they have the picture and the data in one screen. So they have everything in front of them on one click. And they can say, agree or disagree and write a note. Right now with a pilot, we are keeping the communication between the doctor and the patient through Epic, through the standard or the flow they have today. Eventually, we can push data communicating from our application to Epic to talk to the patient too. So, and that's something we are walking before we're running. We're trying to make sure the usability is good, the doctor's getting the right data. It makes sense before start the next level, which is the next step is the communication with the patient.
I've got a few more questions for you.
Yeah,
I'm gonna
sure.
remix. I'm gonna remix one because I think there's a wider audience for it.
Yeah.
I think you sit in an interesting position in experiencing creating medical technology to be sold into the healthcare provider space. Part one
Mhm.
of my question is advice to your peers, fellow innovators. What have you learned recently in your experience as you're building this company, the right way to position yourself to be heard and engaged with by healthcare providers? And part two, uh, what would you say to healthcare providers in the space of helping to foster innovation and create a
Yeah.
space for companies like yours to grow?
Yeah. So that's a great question. So for my fellow founders starting in the medical field, um, it is a long sales cycle. So it's not something it's going to be selling within 30 days after you finish. So you have to be patient. You have to educate your customers about what you're building and show them the value proposition in your product. Because if today there's so many digital health application, it's not meant for everybody. And you see people using it, some doctors using it, some don't use it because one sector or one section, they see the value on this digital health application. They don't see the value in mine because it's not in the same field. So you have to listen, you have to talk to the surgeon, the users, and are you actually solving problem and helping them, or just solving problem is not going to help them? Give him, like, for example, if I tell the doctor, I'm going to send you 10 images a day for the wound and all the data to take a look at it, it's not going to work because they're already overloaded. I
Yeah.
have to make a sense out of the data for them. I have to show them the value what I'm sending. Anybody can send a picture to the doctor, but image quality is important. So that's why we spend a lot of time making image acquisition. Image quality is a priority because without a good image, the doctor is not going to be able to see anything. And that's it's part of it. Like we're delivering on the value proposition. You're going to see a clear image. You can see data makes sense, so you can act on it. We're not diagnosing the wound. We're just providing you with a clean data and a snapshot of the patient's status, so you can act or make a decision on it. So that's the critical things is it's not just in solving the problem, but also providing value for the user.
People often ask, so what's in it for me? Whether they do it
Yes.
consciously or subconsciously.
Yeah, I mean, you can find a friend, surgeon, or doctor to use your app and say a good thing about it, but if it's not going to solve a problem, it's not going to help them, it's not going to go anywhere. I mean, you need people to really say, I can use this. It helps me cut down 2 hours of my day from following up on patient,
Yeah,
or 1 hour, or prevent 20% of my patients to go to emergency room when they don't need to. So that's the value proposition we provide, and that's what the doctor needs to see. And which bring us to the second phase of the question is the healthcare provider. Is they have to look at it. We're not this when we approach them or another digital health company or another AI technology, we'll ask them to look deeper than that. Give the startup a chance to explain what's going on, what's the value proposition, and give them feedback. Maybe it's not for them, but say, hey, we don't do a lot of surgeries, or we already have a platform who can do this for us, but we have a gap in this area. Can you help us in this? It's a both way communication. Like, I'm presenting this, you tell me what's not working and what works for you. I can feel the pain of the healthcare system because I'm sure they get bombarded every day with a lot of startup and new ideas.
yes,
Um, they have innovation centers which they homegrown their own innovation, but also they have to keep the door open also for outside because hospitals and big company move slow. Startup company, that's why they people look at them because they can move fast, they can be creative, and the startup has to listen to the healthcare system. Like, listen, we cannot do something without being HIPAA compliant or without being integrated with Epic.
yeah. So you're saying there's a lot of conversations to be had, but on both ends, listen carefully and see where you can, if you're selling into the provider space, how can I drive value? What's the ROI
Exactly.
for this engagement? And then the other way is give the startup a chance, or if they're headed in the right direction and need pointers, go ahead and provide those
Yeah.
pointers. I just got one more question here then. What's your long-term vision for predictive healthcare and MyHealthPal? Where do you see it going in 5 years?
Yeah.
What we'll be talking about?
Yeah. So actually we touched a little bit on it earlier. So the hospital, they have a lot of data point which they provide the patient to use. For example, if you have heart issue, they have an app for that. If you have a high blood pressure, they have an app to monitor that for you. So for us, the long-term vision is we will be integrating with wearable technology, with the smart implants, and also integrate with other digital health technology. So we will be the platform where we get the data to the clinician and present and use the AI to leverage and come up with a kind of predictive outcome based on all the data points coming from different sources and present to the doctor. So we know to be only focusing on wound by itself, it can be a little bit uphill battles because you can send the patient home today with one app for wound, one app for blood pressure, one app for heart issues. You have to give the patient one tool to enter all the information and present it on one screen to the doctor. And our plan, our goal to be in that position where we collect all the data points from different vendors, different partners, and use the algorithm to present one holistic view about the patient status and condition to the doctor.
That's awesome. In our previous episode with Deb Doolin from BioTrace It, leading the project Pain Trace It,
Mm,
this is a device that attaches sensors to the body and quantifies pain. And so I actually need to connect you to, because that's exactly
that,
these pain is so critical in a post-surgery setting, and predictive healthcare and MyHealthPal so critical in a post-surgical setting. But these two ideas can't be siloed for clinicians and
no,
patients. How does that interoperability and elevated user experience take place through collaboration? So don't worry, I'll set up the
I
introductions.
mean, especially with pain, because pain right now, I mean, I could say I'm in a lot of pain, but for you, it could be, I can handle that pain. So anything can scientifically measure pain, that would be very critical for doctors.
Yes, and it's the combination of great thinkers like you two and others working together in an interoperability space for patients and clinicians that just streamline this. When you think of the big tech firms out there, you think of Google and all of its applications and how all those applications work together, or you
Yeah.
think of Apple or Microsoft, just to name the easy ones. There's quite a bit of thought to build an ecosystem. And it's a little different because those are contained to brand and they all are competing against each other. But in the
And
healthcare space, is there a vision where there's this larger ecosystem where things work together and the best ideas integrate to
mhm.
improve user experience?
Yeah, I mean, so in healthcare, we came a long way from 15, 20 years ago. I mean, you remember you used to have the paper folders, has all your medical records. Somebody has to go through it to know what's going on. Now we're electronic and digital, and now we can exchange data between hospitals and patients can look at the data. So we have to think about it like today, when you sign up for a platform and they say you can log in with the username, with your email or with the Google Mail or something,
Mhm.
and then you allow them data they want to get. Can we connect to your LinkedIn profile and collect data from you? And that's the way we should head in the digital health. The patient logs in, give us access to the data so we can collect, because medical history is a critical during the after procedure during any treatment plan. Because if the patient forget to say, I have a heart issue, I have a high blood pressure, that's going to be a big difference, especially when there's medication involved. If the doctor asks you, say, hey, you need to walk every day for half an hour and you have other issues. So, but instead of trying to connect to different system, if we can say, hey, opt in and give us your data so we
Yeah.
can look at it and use the algorithm better to provide better data to the doctor, and think that's going to be very powerful in the digital health moving forward.
There's been so many times where my wife is in at an appointment with me and interjects and says, "Oh yeah, he fell down the other day," or like brings up something that I just like wasn't thinking about. So I
Yeah.
definitely need my data all in one place because I tend to leave out pieces of the story. I'm sure that doesn't help the clinician.
And also the technology, it's there when you have, I mean, we're still young, maybe our medical history is that thick, but for other people, they have existing condition, the medical history is big. So the technology can go through your medical history quicker than a human being.
Yeah,
So the AI can go through it and summarize everything for the doctor or for us to
yeah.
look at instead of going through everything else. And that's the key, is there's a lot of data out there. We have to make sense out of it and extract what we need in order to provide the right data to the doctor to make a decision. And that's data is powerful. We need that.
That's awesome. Hey, Talal, I thank you so much. It's been a great conversation. I know you're a very busy person, so I'll let you go, but this was a very
Thank you very
good
much.
conversation.
Thank you. I appreciate the time, Max. And hopefully we'll see you around.
Yes, yes. Maybe we'll grab a coffee sometime.
Absolutely.
All right, see you. Thank you for joining us on this episode of the Radiant Podcast. If you found this episode insightful, we'd love for you to subscribe on your favorite podcast app or YouTube and follow us on LinkedIn or X for more updates and insights.